Good morning, Internet, and welcome back to Slim Science for You. Today, I'm going to be reviewing Medscape article on FDA approves Tirzepatide for treating obesity. If you viewed last week's episode on the potential for this, they had commented that they thought the FDA approval would come before the end of the year. And it did. So Medscape has the article. It's written by Miriam E. Tucker, and I will include the link below in the description. So what's going on with the Tirzepatide for treating obesity? So the FDA has approved the Tirzepatide for chronic weight management in adults with obesity or overweight. So I found this very interesting how they're going to describe obesity and or overweight. If you thought they were one and the same, not in this context. So Eli Lilly is the company that produced this, and it is going to market the Tirzepatide injection for weight management under the name of Zepbound. Remember, it was approved in May 22 for treating type 2 diabetes, and I believe it is called Mounjaro. So the new indication for adults with obesity is going to be BMI of greater than 30 or overweight. So in that case, if you're overweight, you have a BMI of 27 or greater with at least one weight-related comorbidity like hypertension, type 2 diabetes, or dyslipidemia. So you can be obese and overweight, and it will be approved for that. So this is going to be a once weekly injection, and it is going to reduce appetite. It activates the glucagon, it activating two gut hormones, the glucagon-like peptide, so the GLP-1, which is what the semaglutide, aka Wegovy does, and glucose-dependent insulinotropic polypeptide. So the Mounjaro, not the Mounjaro, but in this case, the Tirzepatide, and what did we say they're calling it? A Zepbound. Zepbound has two functionalities, the GLP-1 as well as the GIP. And so just as with the semaglutide, they're going to start a dose low and increase it over 4 to 20 weeks to allow the body to adapt to minimize effects that are undesirable. So how did they do this? It was a very interesting, they did 2 pivotal randomized double-blind placebo-controlled studies with obesity or overweight plus. Okay, remember above we talked about how there are 2 conditions. So what they first did, probably in parallel, they had 2 clinical trials. In the first one, they had 2,519 patients who were obese, and they looked at a weight reduction over 72 weeks. What they found was those who received 15 milligram dose achieved an average 18% of their initial body weight when compared to placebo. So this is really interesting. So those who were just overweight, 18% of their initial body weight at the maximum dose. Now, in the other trial that they presented of interest included 958 patients. They were overweight as well as had type 2 diabetes, and they found that they achieved an average weight loss of 12% with once weekly Tirzepatide compared to their placebo group. Okay, so obese individuals at the maximum dose had about an 18% reduction of their initial body weight, while the equivalent in the type 2 diabetic patient, they had 12%. So that's very interesting and good news. So another trial, in my opinion, it's good news. Another trial not related to this was presented in this year's Obesity Week meeting and was published in Nature Medicine. And you can see if you go to this Medscape article, this is an active link. And if you want to actively look at that article, just come to this site, click the link, and you'll be able to see it. What's really interesting about this study is they took individuals, they looked at adults with obesities who did not have type 2 diabetes or diabetes and who'd already experienced weight loss of at least 5% after a 12-week intensive lifestyle intervention. So in this study, they looked at individuals who were obese, not diabetic, and asked the question, does the tirzepatide help these individuals as well? And they did show that there was clinical meaningful weight loss for these adults. So in addition to this 5%, they lost even more. Finally, in another trial, which was very interesting, it was reported in this year's annual meeting of European Association for the Study of Diabetes, found that the tirzepatide continued to produce highly significant weight loss when the drug was continued in a 1-year follow-up trial. And those who discontinued taking the drug while regaining some did not regain additional weight. So essentially we're looking at 4 trials here. The first trial was on obese individuals, and it showed on average an 18% weight loss from the initial body weight over the 72 weeks that they were being studied. In the second trial, they took overweight individuals who had diabetes, type 2 diabetes, and they showed a 12% weight loss. In the third trial, they looked at individuals who had already lost, obese individuals who had already lost 5% of their weight due to lifestyle change, and they found that there was clinically meaningful additional weight loss on the tirzepatide. And finally, in the last trial, they showed that if they continued the tirzepatide an additional 1-year follow-up trial, that they continued to have highly significant weight loss. And finally, they don't show here, but again, click the link and you can see how they are defining highly significant weight loss and how they're defining some regained weight, but not all. I may review that paper on the channel too in a separate video. So the tirzepatide, what are the side effects? Very much like Wegovy or the semaglutide. In my opinion, what we have seen reported for the semaglutide, the GLP-1 receptor agonist, GI side effects include nausea, diarrhea, vomiting, constipation, abdominal pain or discomfort, maybe hair loss, burping, GI reflux. Now, not everybody's going to have all of these. Some people have very, very minimal. It's going to be very individual. And part of the reason for doing this slow ramp up in dosage is to allow the body as well as the user to acclimate to this medication. They also talk about who should not use it. So the individuals who should not be using this are patients with personal or family history of medullary thyroid cancer, or by patients with multiple endocrine neoplasm syndrome type 2. And you should also not be used in combination with Mounjaro or other GLP-1 receptor agonists, right? Because that makes sense. We have in the tirzepatide, if you now add Mounjaro or GLP-1, you're really increasing the active dose by combining those. So you shouldn't do that. And how about other weight loss drugs that are out there that are having some effect? Those have not yet been evaluated. So the Zepbound should go on market in the United States by the end of the year. It's going to have a list price of $1,060, and this information came from a news release by Eli Lilly. All right, well, there's a lot of good things going on in the weight loss market. As I mentioned before, I think we have a real horse race now. The Wegovy semaglutide as a whole has a long delay in having prescriptions filled because of some production pipeline issues that they've had that they think will be resolved by the end of the year. Let's hope they're right. But in any case, my question would be, if an individual starts on the tirzepatide, are they going to switch back to the Wegovy if and when it becomes available? I don't know. Anyway, thanks for watching. Let me know what you think about this. Bye.